doctors and medical professionals of Reddit. What one medical fact do you wish everybody knew? Story 1, it's significantly more effective to prevent cancer than it is to treat it. But the world isn't interested because most people just want a pill to fix their problems. Don't smoke or sunscreen, don't drink excessively, get a bit of exercise, and eat some vegetables. Do those and bam, huge drop in cancer risk. But nobody wants to hear it. Story 2, doctor here. Most important rule, know your own history in drugs. Our EMRs are too inefficient to depend on, especially if you've been to many different institutions. Story 3, nurse here. If you're an alcoholic that's admitted to the hospital, don't lie about how much you drink. There are drugs we can give you to take the edge off of withdrawals. It's safer for you and safer for us. We're not judging you. We have safety in mind. Story 4, some new updates because no one learns. I work in a burn unit. Don't put accelerants on a camp bonfire. Don't go back into a burning house v. clear plane. Don't put accelerants on bonfires. This includes aerosol cans of stuff. Those blow up. Don't make meth unless you have an advanced degree in the field. Don't put accelerants on bonfires. Even if it just won't light, don't let your pot handles hang over the edge of the stove where your kid can reach. Don't put accelerants on bonfires. Even if you've been doing it for years, don't pick up containers of flaming grease and oil. Don't put accelerants on bonfires. Diesel is an accelerant. Don't keep electric cigarettes in your pocket. If you wear oxygen, don't smoke with it on in your lap. Don't burn trash. You don't know what the S in there, probably accelerant. Stop opening your radiator cap unless the car is cold. Carburetor injuries are common. I don't know how it happens. Help me out, car people. Don't put accelerants on. You're gadum. Fire. Story 5, smoking will kill you. Nah. Cancer won't get to me, you might say. And you be statistically right, ITLL be your heart. In the simplest of terms, smoking makes your arteries rigid. So as they progressively get filled with fat, instead of increasing their diameter, they'll just get stuffed until no more blood can get through, and you'll be done. If you're lucky, you'll get some chest pains beforehand, but that's not always the case. Joke's on you, sucka. I got a heart attack and survived. Death ain't got on me. Welcome to the world of chronic heart failure, where from now on, every day that goes by your heart will be less a pump and more a container. Until you get out of breath from just speaking and eventually die. There's no going back. Please stop smoking. Edit, that only happens to chain smokers. I only smoke occasionally. Story 6, if your kid has a fever and you give them Tylenol or ibuprofen to bring it down, they're still sick. You're only treating symptoms temporarily, not curing anything. For the love of everything holy, do not give them Tylenol and send them to school daycare sports birthday per Tysec to become patient zero and infect everyone else. The human rectum is nightmarishly elastic. Story 7, ER doc here, medical fact. Emergency means potential loss of life, limb, or eyesight. It does not mean inconvenience, irritation, or chronic condition. Your sore throat evaluation in the ED is going to cost you $1,000. Go to an urgent care. Story 8, drug allergies and side effects are not the same thing. It makes you look like a crazy person when you have 20 allergies and 19 of the reactions are nausea. Story 9-1. Reverse cowgirl may be a fun position for you, but please be careful, girls. 2. Blood in your pee, when not associated with pain and fever, is something you need to get checked out. 3. Get that new ugly mole checked, especially if it is painful or bleeds spontaneously. 4. Boys, if you notice some irregularity growth in your please, get it checked early. If your ball is the size of grapefruit, ignoring it will not make it go away. It will just increase the risk of worse news than that you're fearing. It is much better to be labeled or worried, well, than the alternative. If we are stressed or rushed for time, it's not personal. It's the system. We may not always say it, but we are grateful for those who take responsibility for their health. Story 10, doctors are there to help you. Stop lying to them. They have to protect your privacy. So if you're doing drugs, tell them they have to keep it secret, and it could kill you if you don't. Story 11, doc here. If you suspect a heart attack, take an aspirin or 2. Not ibuprofen, not paracetamol, not some other analgesic painkiller, an actual aspirin. Also get yourself to a hospital, duh. But that aspirin might save your life. Edit, yes. Chewing is better, but if you swallow it whole, that will also work in a pinch. It's much easier to remember taking aspirin, especially if you're panicking, than to also worry about how to take it. Aspirin falls apart quite easily in stomach acid, and it gets absorbed through the linings of your stomach either way. Always keep things as simple as you can, and get the basics down first. In a pinch, you are much more likely to recall a random person on Reddit saying heart attack aspirin than you would also remember, and don't forget to chew. Story 12, not a doctor, but something a doctor told me when the incident occurred. Girls, if you get excruciating cramps at the time of your period and it feels much worse than it actually is, go to a doctor. When I was 13, I had already been confirmed to having ovarian cyst, and it made it very painful for me during my periods to the point where I had passed out from the pain of it once. However, at one point it felt much worse than it typically did, and I blew it off as being because of my period. It turned out my appendix was bursting. The doctor told me a lot of women blow off period cramps because doctors tend to do the same. Don't. It almost meant life or death for me. Story 13, just don't lie to us. We don't judge you because you're smelly or you like to put things up there. Remember always, we've seen something far, far worse than the gerbil up your butt. Oh, and don't drink and drive. Story 14, vet tech. Your cat is probably obese. So many people free choice their cats because it's easier, or just way overfeed their cats because cats want a lot. You're not doing your cat any favors. He's going to get diabetes. I'd guess that about 10 cats I've seen are actually at a healthy weight. Get a good wand toy and play with your cat every day. And for God's sake, limit how much they eat. Also, treats are supposed to be less than 10 of your pet's caloric intake. Cool it with the treats. Story 15, know the signs of heart attack and stroke, and don't tough it out. These are time-sensitive and potentially deadly events. Paramedic here, super frustrating when I get a patient who didn't call early enough, and because of that they can't get life-saving treatment or the damage is already done at it. If you're having an EKG done, tell them to run a 15-lead EKG. If they don't know what it is, tell them to Google it. Posterior heart attacks are missed because not many people know what a 15-lead is. Story 16, RPH here. Do not keep your medicine in your medicine cabinet in your bathroom. The steam from shower and the temperature fluctuations will degrade your medication. Keep them in a cool, dry place away from direct sunlight. Also, look through your OTC items in your house and clean out the expired drugs and restock your basics: ibuprofen, acetaminophen, Pepto, eye drops, etc. Story 17, not a medical fact. As much as it's just something I wish all patients would do, I'd love it if patients could bring a sheet of paper with all the meds they're on, past medical history, past surgical history, allergies, and family doctor contact info. It's a small thing, but could be so helpful. Story 18, nurse midwife here. I wish people understood that if they are receiving treatment for a condition, they still have that condition. Case in point, if you're taking medication for something, you aren't suddenly free of that disease. Your blood pressure meds are maintaining a normal blood pressure because you have the condition of high blood pressure. Your insulin is maintaining your blood sugars because you have diabetes. Sounds simple, but amazing how much people tell us they have no conditions but are on 1,000 medications that tell a different story. Story 19, your immune system is one of the greatest assets you have, and you never thank it. In your life, your body will autonomously eradicate between 6 to 10 cancers without you realizing. It will fight your infections, repair micro-traumas, and police the entire population of billions of cells in your body without your asking. All it requests in return is a little bit of health to preserve it. Stop smoking, lose weight, maybe exercise a little. Don't drink so much. Your diet is so much more important than you realize. Story 20, dentist here. Just because a toothache goes away doesn't mean it's all better. Many times it's the calm before the abscess. It goes from dying to dead to abscessed in as fast as a day or sooner. Story 21, vaccines are the greatest advancement in modern medicine. They save lives and prevent weeks of lost work each year flu season. If people started seeing more pertussis whooping cough or epiglottitis, part of the throat swells up and can kill children, they get their shots. But vaccines have become victims of their own success. Get your shots to protect immunodeficient people that can't get their shots. Vaccines do not cause autism, TLDR. If you don't get vaccinated and you don't vaccinate your kids, then you are in. Story 22, doctor here. Don't stop your medications by yourself. Just don't. No matter how good you feel, patients stop antibiotics and relapse. So many resistant TB cases here. Stop taking insulin and come with DKA. Stop taking antihypertensives and get a stroke. Don't stop any drug unless cleared prior with your doctor. Most of the diseases can only be managed. They can't really be cured. If you have diabetes, get sugar levels tested at least once a month. Don't ignore it. Don't mix alcohol and antidepressants. Also, no matter how bad it is, we have seen worse. Don't be ashamed. Pull out doesn't mean she won't get pregnant. Pre-cum has too. Last, if you see anyone vomiting and lost conscious, turn them to their side. Less chances of it entering lungs. Story 23, avoid grapefruit and grapefruit juice if you're taking some kind of medication. About 50 of pharmaceuticals on the market are metabolized at least in part by CYP3A4, which is inhibited by compounds found in grapefruit. Story 24, alcohol withdrawal is deadly. Many of my patients don't know this. It's a gamble. I've seen fifth of vodka day drinkers not withdrawal, and 2 to 3 beers day withdrawal. It onsets quickly, and it's deadly. Anyone who drinks almost daily and is deciding to quit cold turkey needs to understand this and notify family at the bare minimum. Story 25 volunteer SCR ship crew member here. When you suspect whoever is lying down is not breathing by themselves, begin CPR immediately and do not stop until medical professional arrives, even if this means that you have to go on for several hours. We do not perform CPR to have the patient miraculously wake up and make out with us. We do this to sustain the most vital bodily function, the circulation of oxygen to the brain, until we can get that person to a hospital. Story 26, I may be alone in this, but I want my patients to know that there is no possible way I can keep up with all the medical advances and new studies that are out there. And I also want them to know that there are thousands of conditions that I learned about in medical school that I've forgotten because I've never seen or recognized them in practice. This is important because my patients frequently apologize for looking up things on the internet. No, don't apologize. I want you to research your condition. I want you to look things up. I want you to know about new treatments, new research, and alternative medications, because often I may not agree with the things you've read, and that's fine too. Ask me about things you've read and the picture you found that looks like your rash. I can't tell you how many times a patient has come to me with a suggestion about a possible explanation for symptoms because they read about it on the internet that turn out to be a correct or at least reasonable guess. Please educate yourselves about yourselves. Some good websites are the CDC website and AFP, or the American Academy of Family Practice. And if your doctor is offended that you're trying to be educated, get a different doctor. Source, I'm a doctor. Story 27, clinical psychologist here. If you need mental health treatment, try your local college campuses. Oftentimes there are training clinics supervised by some of the best clinicians around. Most will provide a generous sliding fee scale. Treatment works, especially for sleep problems, depression, anxiety, PTSD, etc. Also, do not ignore mental health problems in your children or adolescents, including when you're concerned about substance use. Early intervention works best, and if you wait until they are 18, they may not get treatment for another decade because they refuse to go in until they mature in their late 20s. So if your child or adolescent is showing signs of a mood or anxiety disorder, cutting, struggling with ADHD, and is using drugs regularly weekly or more, and you are concerned, consider an intake assessment with a licensed psychologist. Story 28, former EMS here. Don't get angry when that quiet person gets taken out of the ER waiting room before you. You have a headache and are raging, and I can't help you. But that person who just got taken back is quiet for a reason. You're not dying. Death is quiet. I can't tell you how many times I took someone to the ER yelling and kicking and screaming, and when we roll up and they get looked at, it's often minor. I've seen people who I had a feeling would not make it. They don't rave like idiots. They lay still and quiet, and it's almost eerie. Story 29, not a doctor, but 1 year off of the mark as a training psychologist on an interdisciplinary team. I wish patients knew that community resources often work on income-based, sliding fee scales to meet the client financially. Let's be real, mental health coverage is trash right now, but there's an abundance of professionals who acknowledge this and advocate in-house. It is always worth asking around. Story 30, you don't need some kind of prescription every time you go to the doctor. You don't need antibiotics every time you have a sore throat or cold or cough. And you don't need narcotics every time you have pain somewhere. The I need to get something or I've wasted my time coming here mentality is one of the main reasons antibiotic resistance and opiate addiction have surged in the last 20 years. Edit, I'm not a doctor, nor am I claiming to be. Since a friend has sent me a picture of this comment, and others from this thread, appearing in an article on Facebook claiming they're all from doctors, I feel I need to clarify that I'm a medical laboratory scientist who works in a hospital. Story 31, not a doctor, but tell your doctor as much as the truth as you can, your burns after you masturbate. Don't be embarrassed by it. You might have chlamydia or some. Tell your doctor. Story 32, stop smoking. I know it's hard. I know you're addicted. Just stop smoking. Impy here, not every illness is cured by antibiotics. Antibiotics can have nasty side effects, so don't get mad if we tell you that they are not required for your current illness. Story 33, if you get in an accident as a biker, don't take your helmet off your head under any circumstances. You can unhook the strap if you really need it and not suffocate, but that's it. Stop reading here if you're a faint of heart many times. Your head will break like an egg, and the helmet is basically the only thing preventing your skull from being skewered by your cranium shards or spilling out. Story 34, bleeding from the rectum should be taken seriously. Can be fatal if left unattended. Seek medical help ASAP. Edit, it'll clarify spotty bleeding here, and there for a few days may not be severe, but if you keep having problems and it's not stopping, seek care. A lot of people aren't aware of the potential seriousness blood from the butt can be, and it can also be an uncomfortable topic for many people, so they're less likely to seek medical help. Story 35, not necessarily a medical fact, but Please carry an up-to-date list of medications in your wallet, or take a picture of your various pill bottles at home and keep it on your phone. Despite what everyone thinks, everything about you isn't in the system. Story 36, while endocrinologist here, and I have to let off steam. Last month, I lost a 24-year-old patient to diabetes. Seriously, people, visceral fat is serious. Sometimes I see people mocking their potbelly, as if it's not a big deal, but it is. You have no idea how many silent illnesses you may be developing in your body by not monitoring your weight. Story 37, nurse here. Got a few of these, but this is my biggest pet peeve. You can't cure your diabetes by ignoring it. And stop eating 5 extra pieces of cake and just injecting more insulin. That's not how this works. Also, it doesn't matter if you only drink Diet Pop. Diet Pop is still terrible for you, especially if you're diabetic. Drink some water, Jesus. Story 38, if there was the slightest bit of benefit from that alternative health treatment, mainstream health would be all over it. No one passes up a profit or the chance to empty out this mega overcrowded hospital for some kind of philosophical hang-up. Which overcrowded hospital? Every single one in the world bar the private U.S. ones that permanently have beds. Everyone else is struggling, so that's 99 of the world's hospitals. Story 39, if you want to keep hands, fingers, upper limbs intact, do not punch a wall car door guy in the face brick, etc. You will end up with a boxer's fracture or a break of your 5th metacarpal bone. Most of the time, everyone will know you were drunk when it happened, and it's not comfortable or fun. Do not reach into the chute of a running snowblower. Even if it stopped because something is stuck in there, do not attempt to fix your chain-driven garage door opener by putting your fingers in the track and asking your wife to hit the button. Do not reach into an auger at work trying to retrieve your safety glove that just fell in there. Do not hold on to something at work that winches rope. If you have a wound on your hand, fingers, arm, and it is oozing something that looks green, yellow, white, or pink, go to the doctor and have it looked at. You may save yourself from an amputation. Source them an RN at an orthopedic surgery center. All of these things have happened numerous times. And yes, archaic as it seems, sometimes people have to get fingers or even hands amputated in this day and age because they ignored an infection. Story 40, not a medical professional, but I know a few family members who are. The one thing they all agree on: diabetes. Well, you're up if you don't take it very seriously. Control your weight. Control your sugar intake. Story 41, physical therapist here. Take time to build up your strength and endurance. You didn't get weak overnight, and you won't get strong overnight either. Also, with the exception of pregnant women, bed rest doesn't make you stronger or healthier. Quite the opposite. For every day you lay in bed and rest, you have to work for 3 days to recover from the muscle wasting. Story 42, not a doctor, and this is a minor thing. But if you don't have celiac disease, gluten is not bad for you. More important, vaccines do not cause autism. They save lives. Story 43, Australian paramedic intern here. We're not the police, and we really honestly don't care about any of the illegal or not you have done or taken. We just need the full story to make sure that you could get the best targeted treatment. Also, we don't mind getting called to old people falling and not being able to get up, especially if they have no family or no way to contact them. For me, that's a medical emergency, because if you stay there, you will die, and paramedic school taught me that that is bad for you. Story 44, the pneumonic device for signs of a stroke is F.S.T. face observed drooping of one side of the patient's face. Arms, ask the patient to raise both arms to shoulder height. One side will be unable to comply or will be unable to maintain a height. Speech, patient is slurring their speech time. Determine the last time a patient was behaving normally. If this time is very short, there are medications first responders can administer. If it's been several hours frequently overnight, the risks of such medication outweigh the benefits. Story 45, priority is given to patients according to their level of state at the time. Be a patient. It's not a simple first come, first serve basis. In the meantime, go over what you're going to say, write out your own little medical history and synopsis of your current predicament. Use your time wisely whilst you are waiting to be seen. This will help clarify things and save consultation time, meaning everyone gets to be seen more quickly. Story 46, I am late to the game, and this will get buried, but take your blood pressure medicine. Please, I'm so tired of seeing young adults come in with kidney failure because they didn't want to take their meds. Most of it is cheap as dirt. You can get 4 generics at Walmart. Influenza is a respiratory illness. Please stop saying you have the flu when you have vomiting diarrhea. You don't have the flu. Story 47, if you're prescribed a pill for a chronic condition, you'll probably be on that pill for the rest of your life. That's not a bad thing. It's keeping you healthy. I've seen too many people stop taking their blood pressure or seizure medications because I was feeling better, so I thought I didn't need them anymore. No, you were feeling better because you were taking them. Don't stop taking any long-term medication without consulting your doctor first. Story 48, nose. Keep your head forward and pinch as high on the soft parts as you can go. Tilting your head back and holding your nostrils just means a stomach full of blood and throwing up nasty clots. Antibiotics will not cure the flu. Story 49, anything that is awkward, unpleasant, or embarrassing to discuss will be significantly more. So if you wait to get a check treated, the funny spot on your neck that was ugly a few weeks ago could have been treated with tablets, but now you get surgery to remove the ever-growing pus-filled cyst. Story 50, not a doctor. Cut the fact I've heard time and time again while chatting with doctors is people need OT no. They call it your health for a reason. It's yours. You need to take responsibility for it and be aware of it. We're doctors, not psychics. Story 51, oh yes. We will always be there and will always by law take all comers. However, just as you don't go to a cardiologist for foot pain, don't seek care from an emergency medicine physician for your non-emergency. We are highly trained in true emergency situations. It's what we love. However, once it has been assessed, you don't have an emergency, you get our best educated diagnoses, which may fall short of the true diagnosis and treatment regimen, because we don't have the tools or time to fully work up every complaint. Story 52, please go get your yearly checkup bloods done. 2 tubes of blood will tell you so much about your health. It is way easier to treat conditions early than later on. My grandma let her chronic leukemia get way out of hand before going to her doctor about it. If Shed had yearly checkups, Shed probably have found it much earlier on and not had to have quite the intensive bout of chemo she had to have. She's fine now, but I'm still annoyed she never went to her doctor earlier until she was really sick. Story 53, you're going to die. The rate at which that happens can often be controlled, but you're the one who has to do that. I can give advice, I can offer medication, I can't make you take either. Story 54, one that I hear from nurses I know is apparently some people don't know that antibiotics won't work on viruses like the common cold. If you take antibiotics for the cold or the flu, it won't help you, and ITLL just spread resistance to more bacteria. Only take antibiotics if the doctor recommends it before you bring it up. I'm often shocked to discover that people don't know this one. Story 55, the most effective and cheapest forms of medicine are preventative medicine. Eat healthy food, don't overeat, get lots of sleep, exercise regularly, don't smoke cigarettes, drink in moderation, brush and floss. Story 56, physician salaries and compensation make up less than 2 of the annual healthcare expenditures really United States. Less a medical fact and more a fact of the healthcare delivery in this country. Story 57, losing weight when you didn't really try to lose weight is cancer until proven otherwise. People ignore this sign so often, and when we finally make a diagnosis, it turns out they noticed the weight loss months ago and could have been picked up earlier. If you lose more than 5 of your body weight and didn't try, see a doctor even if you're young. Make an advanced healthcare directive. I work in the ICU. We can essentially keep you alive on life support indefinitely as a vegetable. Nobody wants that to happen to them, so make sure it doesn't happen to you. At some point in your life, you'll probably have a colonoscopy. Most people have one. Nobody admits they had it. Don't be embarrassed by it. Don't smoke, eat, drink alcohol, skip exercise, never go outside, binge TV, but just don't smoke. People always talk about lung cancer as the reason not to, but YouTube, COPD. The ones who don't die of lung cancer die a slow and drawn-out death where they essentially get more and more breathless over about 10 years. It's horrible, and unlike lung cancer, is near guaranteed to happen to lifelong smokers. If I was a smoker, I'd rather get lung cancer and die quickly than face COPD. Story 58, the hospital is not a Hilton. I'm sorry, I have to wake you up in the middle of the night to assess you. I'm sorry I can't be at your beck and call every second of my shift. And I'm sorry I have to follow orders and safety regulations. But you're sick and we're here to help you heal, not give you a spa vacation. Everything we do is for your benefit, even if it isn't the most fun. Story 59, if you see someone having a seizure, do not try to put anything in their mouth. They may chomp through whatever you put in there, occluding their airway and killing them. Also a great way to get your fingers bitten off. Story 60, fever in kids is 104, and there is no high temp threshold where one must be seen in the ER. Kids in daycare get sick once a month on average. Jaded pediatrician. Story 61, as a former pharmacy technician and future pharmacist, we don't control how much you pay for your prescriptions when you run it through your insurance. For the love of all that is good and holy, take a minute to try and understand what your insurance is. Story 62, that people who have health problems don't always show objective signs and need understanding. Came to this realization after having a car accident and having my medical colleagues tell me I looked totally fine, but in reality, I was suffering from constant pain, which to this day, I still suffer. Story 63, the diverticulosis pockets in your intestine is complicated by absence of nuts, seeds, skins, etc. Everyone still believes it's helpful to have these foods omitted. Story 64, former combat medic with the Army. Don't wait to get treatment. Rarely will it just go away or get better. I can't count how many times I do primary evaluation of a patient who came in a sick call in the morning with some sort of ailment. And when ID ask how long they experience the symptoms, ID get a response like, oh, maybe a month. A month. That's no longer an illness. That's a condition. Remember, the older you are, the less likely you are to bounce back from an injury or illness. And not getting it taken care of right away can end up making it a lot more difficult to treat and recover from. And practically speaking, getting something cared for immediately means that you're going to suffer for a lot less time. Story 65, show up to your appointments on time, or better yet, a few minutes early. Don't get pissed at us because you were stuck in traffic and are an hour late with a Starbucks in hand. Story 66, you can't treat a virus with antibiotics. Just because your doctor or your kid's pediatrician gave you some, that doesn't mean they're better at doctoring it went away on its own with help from your immune system. Story 67, keep some low-dose aspirin always at hand. That's literally the difference between life and death during a myocardial infarction heart attack. Also, heart attacks are weird. They can sometimes manifest only as sore throats or simple heartburn. Story 68, the difference between an emergency, and that can wait be seen at an urgent care. OMG, if you had to wait an extra hour or more for your appointment, do not think your doctor doesn't care. Most likely they had an unreasonable schedule to adhere to, usually out of your doctor's control, or they had somebody extremely complicated or critical ahead of you that took lots of extra time. Most doctors hate getting behind or keeping their patients waiting. Story 69, paramedic here. Have your DNR or MOLSD form with you ready if you don't want yourself or loved one to be aggressively resuscitated. Healthcare proxies and wills do not suffice, and it's not a healthy way to deal with death only the second it arrives. When you can prepare one 106 years old female I've treated has hers framed next to her bed, and that's what I'm talking about. Story 70, not a doctor, health economist. People need to know what opportunity cost is. If you have a treatment, someone else can't. Every healthcare system is overburdened in some way, and all resources are finite. If your doctor says you need to exercise, eat healthy, and take statins, do it. Having a stroke or myocardial infarction doesn't just for you. It also sucks for the person who needed the ambulance too, but hadn't been given the necessary drugs and lifestyle advice to prevent an assault or car accident. If you can take steps to prevent something, do it, because it's not just your own life you're saving. Story 71, not a DR. Don't even play one on Facebook, but my friend is a nurse who works for a cardiologist. Stop giving kids energy drinks. Hopefully an actual doctor could elaborate on the reasons. Please. Story 72, as an ER nurse, I would settle for knowing what the definition of emergency is. 85 of the patients I see are using the ER, ICA clinic, and it's dropping the ability to treat truly sick patients when the beds are all occupied by non-emergent issues. Story 73, that if you abuse your body, one day it's going to tap out. You don't have to be a marathon runner or a bodybuilder. Just take care of yourself. Women, stop talking about fat shaming and lose some god weight. You may be big and beautiful, but you're killing yourself. Type 2 diabetes, heart disease, you're a ticking time bomb. Men, you're just yourself over, believe it or not. Living an unhealthy health style is unhealthy. It's putting a burden on our already overburdened healthcare system. Oh yeah, stop demanding an antibiotic for every sniffle. You're killing the human race. You're just breeding antibiotic-resistant superbugs. Pretty soon nothing will help with infections. Let the plaque begin. Story 74-1. HPV is extremely common. Basically, everyone who is active and over the age of 30 wasn't vaccinated has, or has had HPV, and most people, young and healthy people, will clear the virus on their own. 2. If something isn't right, and your provider is dismissive, go to someone else. You have to advocate for what you need. 3. Cigarettes are the worst thing you can do for your heart. Smoking will build plaques that can block blood flow to your heart and cause a heart attack. Story 75, don't ask for, or take if in your country it's sold over the counter for antibiotics when you have a common cold. Not only does it not help, you are also contributing to the spread of multi-resistant bacteria. Background: firstly, a common cold is defined by a running nose, clear, not putrid, fever, general feeling of being unwell, a sore throat, and or coughing. You don't have to have all of these symptoms, but all can occur. It is usually self-limiting ANS of viral infection. Antibiotics work against bacteria, so there's nothing to win here. The indiscriminate killing of potentially beneficial bacteria by antibiotics helps selecting the strongest, which may be those with resistance mechanisms that can bite you or someone else in the later. If you're not an at-risk population under 65, not immunocompromised, No chromic heart or pulmonal conditions, you'll get over it by just taking it slow for a few days, and keeping hydrated, the latter is most important. Only if breathing becomes painful or symptoms get worse after a few days, antibiotics may be called for, but so would be blood work or maybe an x-ray. So you should see a doctor before starting to take it. Source: from a doctor in Germany at a typo. Story 76, if your testicles have lumps on them, go to the doctor immediately. Do not wait for half a year and then get told you've had testicular cancer this entire time that has now spread to your lymph nodes and blood. Sake, man, Dr. Hear More Fine will not kill your loved one. And no, I cannot give a bit more to make it go faster. I work with a lot of terminal patients, and their families often have to decide for them. Morphine in appropriate doses is the best tool I have to treat pain and shortness of breath. When I suggest it to family, however, they either react shocked because they think I want to euthanize the patient, or they ask me to give a bit more to help them along. And in a sense, euthanize the patient. You would be surprised how many families wanted to go faster in the end, even when their loved one is in no pain or discomfort. Story 77, strength training and building up decent muscle mass is better for you in the long run than just jogging. You don't got to get ripped. Just keep some muscle tone and flexibility as you get older, and you'll be a lot better off. Unless you want to be that 90-year-old who is utterly shredded, then you do you, I guess. Story 78, the trained and educated doctor you're going to see to treat a problem and has physically seen you and your symptoms knows what the F they're talking about better than WebMD or some random person on the internet. Story 79, take care of your health. Your future self and the future economy will thank you. Get your screening colonoscopy at age 50 earlier in some instances. The worst part is the prep. You won't remember or feel the procedure. I just feel like the best nap you've ever had. Story 80, former GI professional here. 910, your horrible stomach pain can be solved by just taking a dump. Sounds simple, but it can be really that easy. Chronic liquidy stools. 910, it's your diet. Chronic constipation. 910, it's because you aren't drinking enough water. If you're a male at 50 or a woman around 40 to 45, go schedule a colonoscopy. Seriously, do it. A small polyp that we could take off in 10 seconds will become a larger problem if ignored. So many people that came in at the right age and saved themselves a lot of bullshit later in life, or literally saved themselves from colon cancer because we caught it early. At the same time, so many that put it off for years and came in with a very, very serious colon problem. Go do it. It sucks, yeah, but so does cancer.